Hello everyone and welcome to a new session of clinical pharmacology. Today we are going to speak about fluoroquinolones. Fluoroquinolones are groups of drugs belong to the antibiotic. Okay, let's get started. Okay, this slide here summarizes all the information about the fluoroquinolones. As you can see in this slide here, we have fluoroquinolones with the first generation represented by naldexic acid, the second ciprofloxacin, then we have levofloxacin belong to the third generation, moxifloxacin, dilafloxacin belong to the fourth generation. Again, the slide summarize all the information about fluoroquinolones. As you can see, naldexic acid, first generation fluoroquinolones, considered like narrow spectrum antibiotic used for the urinary tract infections, followed by ciprofloxacin. The spectrum, antibacterial spectrum increased, more effective than naldexic acid. Ciprofloxacin used for traveler diarrhea, urinary tract infection, typhoid fever, anthrax. Moving to the levofloxacin and moxifloxacin. This is, as we mentioned, this is a synopsis of fluoroquinolones. Levofloxacin, moxifloxacin, considered like respiratory infection antibiotic. So used for treatment of respiratory infection, used for treatment of anaerobic. For example, when we have bacteroid fragilis, we use levofloxacin, moxifloxacin. Levofloxacin, moxifloxacin used for pneumonia as specifically community acquired pneumonia, CAP. Then we have dilafloxacin. This may be the most important characteristic for dilafloxacin is used to treat MRSA, methicillin resistant staphylococcus aureus. What we need to know about fluoroquinolones, as you can see, we have fluoroquinolones, the suffix floxacin, FL stands for fluoride, floxacin, xacin stands for the antibiotic. Fluoroquinolones will distribute through the kidney, lung, bone, stool, and white blood cells. That means fluoroquinolones able to enter the cells, able to enter the macrophage and other white blood cells. Okay, we can prescribe the fluoroquinolones orally, and we have some of them prescribed IV. We're going to discuss that later on. How this medication work for fluoroquinolones, mechanism of action, we need to remember that the fluoroquinolones inhibit topoisomerase 2 and topoisomerase 4. We have some warning precaution, and we need to remember that. Don't use this medication in children less than 18 years of old, or during pregnancy or breastfeeding. We have some maybe black box warning. We are going to speak about that. The question now is the fluoroquinolone, or are the fluoroquinolones bactericidal or bacteriostatic? Fluoroquinolones considered bactericidal. That means fluoroquinolones able to kill the bacteria. Moving to the next and the important topic here about black box warning, that fluoroquinolones may cause tendonitis, tendon ruptures, peripheral neuropathy, and central nervous system effect. Could be hallucination, could be seizure, could be tremor, and so many effects. Okay, fluoroquinolones first introduced to the medical practice is since 1960, and started with the synthesis of naldexic acid. As we mentioned, naldexic acid considered like first generation of fluoroquinolones, naldexic acid. Then they modify the structure of naldexic acid. The modification, the aim or the purpose of the modification is to produce something like to enhance the spectrum of activity, to improve pharmacokinetic, and to stabilize the compound against resistance. So we have development history here for the fluoroquinolones. How the fluoroquinolones works: the fluoroquinolones inhibit replication of bacteria. inhibit growth of bacteria, inhibit reproduction of the bacteria by the inhibition of DNA. What type of DNA will be inhibited by fluoroquinolones? We have DNA gyrase, which represents with the topoisomerase 2 or with the topoisomerase 4. So the fluoroquinolones inhibit the DNA gyrase. Another name for the DNA gyrase will be type topoisomerase 2, and we have DNA topoisomerase 4. And we know that according to the bacteriology, topoisomerase, this enzyme, topoisomerase 2, responsible for the replication of negative gram bacteria, and topoisomerase 4 representative for positive gram bacteria across reproduction and replication. When this fluoroquinolone prescribed for to treat bacteria, the fluoroquinolone lead to the cell death, lead to the bactericide, lead to the killing the bacteria, and we call fluoroquinolones considered like bactericidal. Okay, speaking about the mechanism of action of fluoroquinolones. Fluoroquinolones inhibit replication of the fluoroquinolones inhibit replication of the DNA bacteria, inhibit replication of the bacterial DNA by the interfering with the action of DNA during bacterial growth and reproduction. Two enzymes will be affected by the fluoroquinolones. Two enzymes will be inhibited by the fluoroquinolones. The first enzyme, DNA gyrase, which represent the topoisomerase 2, and topoisomerase 2. This enzyme is responsible for growth, reproduction, and replication of gram-negative bacteria. And the fluoroquinolones also inhibit topoisomerase 4, and this enzyme responsible for growth, reproduction, and replication of positive gram bacteria. This will lead to the bacterial cell death, and therefore we call the fluoroquinolones like bactericidal antibiotic. Okay, the purpose of this image here only to represent the mechanism of action on the chart here. As you can see in this graph here, we have the DNA strand, two strand, supercolloiding strands, and then we have the enzyme DNA gyrase, topoisomerase 2, topoisomerase 4, and responsible for the maybe break or like divided this strand to the two branches, and then we have the DNA polymerase for more replication. So topoisomerase 2 and 4, this enzyme is responsible for replication growth of bacteria. As you can see here, our fluoroquinolones medication inhibit this enzyme. It inhibit topoisomerase 2 and inhibit topoisomerase 4. Okay, speaking about the fluoroquinolones generation, we have 4 generations belong to the fluoroquinolones. First generation belong to the fluoroquinolones. We have naldexic acid, the brand name. We have naldexic acid and the brand name Nigram. For the second generation, we have 3 fluoroquinolones: ciprofloxacin, brand name Cipro or Cipro XR. Then we have ofloxacin, floxine. Then we have norofloxacin, noroxine, the second generation, and the main medication in the second generation will be ciprofloxacin, Cipro. So we need to remember the first medication in this generation, ciprofloxacin, the most important prototype. Moving to the third generation. Third generation fluoroquinolones, we have levofloxacin, only one medication. So third generation, one medication. First generation, one medication. We need to remember that. For first generation, we have naldexic acid. Third generation, we have levofloxacin. So coming back to the third generation. Third generation, we have levofloxacin and the brand name Levaquin. Okay. Moving to the last generation, we have fourth generation, we have moxifloxacin, gemifloxacin, delafloxacin. Moxifloxacin, brand name Avalox, gemifloxacin, brand name Factiv. Then we have delafloxacin, brand name Baxdela. So we have three medication belong to the fourth generation: moxifloxacin, Avalox, gemifloxacin, Factiv, delafloxacin, Baxdela. This is a group of medication belong to the fourth generation. Okay, pharmacokinetic of fluoroquinolones. We are going to speak about absorption, distribution, and elimination. The characteristic of the fluoroquinolones. Fluoroquinolones could be prescribed orally or IV. When we prescribe fluoroquinolones orally, they will absorb well through the GI system. Fluoroquinolones represent high bioavailability. They said levofloxacin and moxifloxacin has maybe 90% of bioavailability, and the definition for bioavailability means like the percentage of drugs arrive to the bloodstream in unchanged form. So when you prescribe, for example, 100 milligram of levofloxacin, 90% of this levofloxacin, 90 milligram, will arrive to the bloodstream. Important issue talking about the drug-drug interaction here. We have to be careful when prescribe levofloxacin orally to your patient. If the patient takes sucralfate, if the patient take antacid, the aluminum or magnesium, if the patient suffers from anemia and she treated with the ions, or if the patient take any vitamin complement with the zinc, calcium, and other cation, these agents, sucralfate, antacid, ion, zinc, calcium, these agents bind to the fluoroquinolones and prevent or inhibit absorption of fluoroquinolones. So it's very important to advise your patient, educate your patient not to take this medication with the fluoroquinolones in order to maybe enhance and keep the fluoroquinolones active in a human body. Okay, distribution. Binding to the plasma protein 20 to 84%. It's not this does not maybe provide a lot of data there, but we can discuss that if we have some other medication may interfere with the same protein binding and may offer the risk of drug-drug interaction. So you have to keep this in consideration. You have to ask, does the patient take any medication for, is this medication interfere with the absorption of fluoroquinolones or the protein binding with the fluoroquinolones? Okay, another important issue here, you can see fluoroquinolones have the ability to penetrate the tissues with a high concentration. Fluoroquinolones are able to arrive to the bone. Therefore, we can use fluoroquinolones for bone infections. Fluoroquinolones arrive with a high concentration to the urine. Fluoroquinolones, we can use it for urinary tract infection. Prostate, we can, if the patient suffers from inflammation, prostatic inflammation, fluoroquinolones considered one of the most important medication for the prostate inflammation or infections. For the patients suffering from lung infections such as bronchitis, fluoroquinolones considered one of the most important medication for the treatment. Even the fluoroquinolones penetrate to the central nervous system, but we can use it for some type of infection. So if you speak about meningitis, the drug of choice for meningitis, I will go with the ciprofloxacin, for example, or sorry, not ciprofloxacin, with a cephalosporin, such as ceftriaxone. Okay. Another important maybe characteristic for the fluoroquinolones, as you can see, fluoroquinolones accumulate inside the cell, intracellular accumulation. Fluoroquinolones accumulate inside the cell, such as macrophage, white blood cells, leukocyte, polymorphonuclear leukocyte, and therefore we use it for the infections such as chlamydia, listeria, and mycobacterium. So this explains why fluoroquinolones considered like effective agent for treatment of intracellular infections such as listeria, chlamydia, mycobacterium, because this medication fluoroquinolones able to arrive inside the cell such as macrophage and polymorphonuclear leukocyte. For the elimination, we need to remember important topic here. They said most of fluoroquinolones eliminated through the renal. Therefore, we need to adjust the dose if the patient suffers from renal dysfunction or renal failure. We need to adjust the dose. We have one exception, moxifloxacin. Moxifloxacin primarily eliminated through the liver, and no need to adjust the dose for patients suffer from renal impairment. So the question here, if you have patient and this patient suffer from urinary tract infection, and this patient suffer from chronic kidney disease, the drug of choice for this patient will be moxifloxacin. Okay, because moxifloxacin mainly eliminated through the liver, and there is no role of the renal in the elimination of moxifloxacin. This slide, or this maybe two slides to consider, like what the most important are the most important slide for us. So we have fluoroquinolones, third generation. Here we have now we have one antibacterial there, naldixic acid, nigram here, and you can see here to consider like non-fluorinated. We don't have fluor here. Non-fluorinated quinolones, narrow spectrum, mainly affects a specific type of bacteria. This bacteria belong to the aerobic gram-negative bacteria, and mainly affect the enterobacter bacteria. This medication, naldixic acid, used for the treatment of urinary tract infection. So again, moving to the second generation, we have two group of medication there. We have ciprofloxacin, we have norofloxacin. What happened here? What are the differences between first and second? They said this type of medication, cipro and norofloxacin, has maybe enhanced intracellular penetration, become active, more active against the aerobic gram-negative bacteria, and broaden coverage of disease or infection. So the second generation, ciprofloxacin, norofloxacin, maybe has enhanced intracellular penetration, effective against the gram-negative, aerobic gram-negative infections. And if you compare it with the naldixic acid with the first generation, this group of medication has broadened coverage of bacteria. Okay, moving to the third generation. Third generation fluoroquinolones, one medication here in this generation, we have levofloxacin. Levofloxacin considered active against the gram-negative, the same as second generation, effect against the gram-negative bacteria. What else? Again, that they said it's effective against the gram-positive bacteria, and effective against the atypical microorganism. Three advantages. Number one, for third generation levofloxacin, effective against the gram-negative bacteria, effective against the gram-positive bacteria, effective against the atypical microorganisms such as chlamydia and mycobacterium. Fourth generation, we have two medication here in this slide. For the fourth generation, two medication, we have moxifloxacin, delafloxacin. You can see the list of activity here, or broad spectrum: aerobic gram-negative bacteria, gram-positive bacteria, atypical microorganism, and anaerobic bacteria such as Bacteroides fragilis. Also, we need you to remind you here that the delafloxacin is like most effective medication for the MRSA and Pseudomonas. Okay, speaking about the fluoroquinolones clinical uses, the first maybe important, when you have respiratory infection and this infection resists the treatment to the other medication. As you can see here, we use fluorofloxacin and moxifloxacin. So one of these medications considered the most important medication for the treatment of resistance respiratory infection. So when you have a respiratory infection and this infection resists other antibiotic, this is a medication, levofloxacin, moxifloxacin. Moving to the ciprofloxacin, when you have gastrointestinal tract infections and the patient, for example, suffer from acute diarrhea illness, ciprofloxacin. If the patient suffers from anthrax, we can use it for treatment and prevention. We have ciprofloxacin, drug of choice. So we need to remember that for anthrax, drug of choice for treatment and prevention. Another alternative option, we have levofloxacin, doxycycline. When the patient suffers from urinary tract infection, we go with the ciprofloxacin or levofloxacin. When you have anaerobic infection or bacteria, moxifloxacin that will be the best treatment. Uh, Even for the levofloxacin, moxifloxacin, you can see it here. And this is a group of medication, levofloxacin, moxifloxacin, known as respiratory fluoroquinolones. So when you have respiratory infections, and this infection does not respond to the treatment, traditional treatment, respiratory tract infections such as beta-lactam, penicillin, cephalosporin. So this is the alternative here. So this alternative option will be levofloxacin, moxifloxacin, considered like respiratory fluoroquinolones used for the respiratory infection. So if the patient already on beta-lactam antibiotic, but this medication, this group of medication is ineffective in the treatment of respiratory infection, the alternative will be levofloxacin, moxifloxacin. They tried to remind us here, they said ciprofloxacin. Ciprofloxacin is not considered like first choice for the treatment of pneumonia and or sinusitis. And we have the reason because ciprofloxacin only cover the gram-negative bacteria. If you go to the previous session speaking about ciprofloxacin broad spectrum. Okay, ciprofloxacin, as you can see here, is active against the gram-negative bacteria, including Pseudomonas aeruginosa. We can use ciprofloxacin for traveler diarrhea. We can use it for treatment of the typhoid fever, anthrax, prevention and treatment. When we use it for the Pseudomonas aeruginosa infection, they remind us to use high doses of therapy to cover the Pseudomonas infections. Levofloxacin, so the only thing for levofloxacin, you can see levofloxacin cover gram positive bacteria, gram negative bacteria, and a typical bacteria. So levofloxacin considered first line therapy for the community acquired pneumonia. So we use it for pneumonia, acquired community pneumonia, and consider like second line for the typical microorganism. But we need to remember this highlight here. Levofloxacin, first line therapy for community acquired pneumonia. Ciprofloxacin for traveler diarrhea, typhoid, and anthrax. Okay, moxifloxacin. We use moxifloxacin for the treatment of gram-positive, gram-negative, anaerobic bacteria, mycobacterium, and you can see here it's like use it for the community-acquired pneumonia. We use it for intra-abdominal infections, moxifloxacin, pneumonia and intra-abdominal infection. What about delafloxacin? Delafloxacin, this medication, we use it mainly, or not mainly, and the major point, we use it for MRSA, methicillin resistant staphylococcus aureus. We use it for the case of anaerobic bacteria, for example. The indication here with the clinical use, the main clinical use for acute bacterial skin and structural skin infection. So you can see here we use it for acute bacterial skin and acute skin structural infections, available oral and available intravenous. Gemifloxacin, again, we use it for the same community-acquired pneumonia, and this medication available only oral for an oral formulation. Okay, what are the adverse reaction of fluoroquinolones? We have common adverse effect, but we have other adverse effect like less common, but consider like black box warning for the fluoroquinolones. As you can see, patient may suffer from nausea, vomiting, headache, dizziness, and this is the most common cause of that lead to the patient stop taking this medication: nausea, vomiting, headache, and dizziness. But we have the black box warning there. This medication may cause tendonitis, tendon ruptures. This medication may cause peripheral neuropathy. We have to be careful here when you have patients suffer from diabetes, because the diabetes may associated with the peripheral neuropathy, and this group of medication maybe aggravate the peripheral neuropathy. So for this reason here, we have to be careful not to use this medication in patients with diabetes mellitus because of the overlap side effect. This medication affects the central nervous system. The patient may suffer from hallucination, anxiety, confusion, and seizure. So the patient suffer from history of epilepsy. We have to be careful, and we don't recommend to use this medication in patients with the epilepsy. When you use this medication, we recommend patient not to expose to the sun, and we because this medication may cause phototoxicity, may cause sunburn reactions, and therefore we recommend patient to avoid exposure to the sun during treatment with the fluoroquinolones. Again, regarding the tendonitis and tendon rupture, this medication may cause arthralgia, joint pain, arthropathy. So this is very important. So, for example, when you have patients suffer from rheumatoid arthritis, if you have patients suffer from osteoarthritis, or if you have patients suffer from gout, for example, we recommend the patient not to take this group of medication, because this medication cause arthralgia, arthropathy, and we don't recommend to use this medication. This medication also may involve in prolonged QT interval and cause cardiac arrhythmia, and we have to be very careful in patients from heart disease such as heart failure or cardiac arrhythmia. This medication may cause hepatotoxicity. Therefore, we recommend, if you use this medication for long term, we recommend to monitor the liver function. Okay, regarding precautions and warning, younger children less than 18 years of age have higher chance of getting bone, joint, or tendon ruptures, musculoskeletal side effect problem such as pain, swelling, while taking ciprofloxacin, for example. We don't recommend to use it in children less than 18 years of age. What about pregnancy and breastfeeding? The same situation. It's not recommended to use fluoroquinolones during pregnancy or during breastfeeding. Okay, speaking about fluoroquinolones drug interaction, this is important things because we need to take this in consideration when you prescribe fluoroquinolones to your patient. You need to take the drug history from your patient. You need to ask your patient, do you take any medication? And we need to explain why it's important to ask about the drug history. For example, we have here example from the fluoroquinolones. Ciprofloxacin inhibit cytochrome for B450, 1A2 cytochrome, and 3A4 cytochrome. And this cytochrome involved in metabolism of several medications. So I will repeat this one again. Ciprofloxacin inhibits cytochrome 1A2, 3A4, and this enzyme, this cytochrome, responsible for metabolism of several medication. One of these medications, thiophelin, tizanidine, warfarin, ropinirole, duloxetine, caffeine, sildenafil, and zolpidem. So what happens here when the fluoroquinolone prescribed and inhibit metabolism of this medication, the result will be increase activity of this medication, or we can use it like prolong activity in the plasma, and may cause toxicity of this medication. So increased effect of this medication. Thiophelin, this medication used for for patients from asthma, but thiophelin has narrow therapeutic index. Any change in the thiophelin blood concentration, the patient will lead to the toxicity. So therefore, it's very important when the patient suffers from asthma or like respiratory chest infection with asthma. So the patient, if the patient on thiophelin, we don't recommend to use thiophelin with the fluoroquinolones due to the increased level of thiophelin in the blood and increased risk of toxicity. The loxatine, this medication belong to the group of SNRI. SNRI, this is serotonin norepinephrine reuptake inhibitor. This medication belong to the antidepressant agent used for treatment of depression. Also, when we use it with the fluoroquinolone, this will increase level of the loxatine and so on. All these medications is very important in a clinical practice, but you need to take the drug history from the patient and try to remove the agent. For example, try to replace it with another agent. We need to monitor the drug interaction during the treatment. So not only to prescribe the medication to your patient and then leave the patient going to the home. You have to keep contact with your patient, communicate with your patient to be sure the patient does not suffer from any side effect, does not suffer from any drug-drug interaction. Okay, this concludes our topic about fluoroquinolones today. We covered the mechanism of action, generation of fluoroquinolones, clinical uses, adverse effect of adverse drug reaction of fluoroquinolones, black box warning. Thank you for your watching and see you in the next video. Have a great day.